Hi, everybody. I was just waiting for a couple more people to trickle in. Uh, my name is Babs Brilliantine. I'm going to be your presenter today. Today, we are discussing connection, peer support, and a circle of care. We are from Nurse2Nurse. I recognize a couple of your names, and for everybody else, welcome. Really great to see you here. All right, you can advance. Next slide, please. Thank you. A few people from our Nurse2Nurse team on here. Sherry Castellano, she's our director. Myself, I'm in the middle. I know it says Barbara, but that's my formal name. I go by the alias / nickname Babs. And our clinical supervisor is Michelle Julian there on the right. Next. Would love to hear from you right now. So you can either chat in or if you want to, if you feel comfortable unmuting, we would love to hear a little bit about you, your years working, your name. You could just give first name if you want, nickname, whatever, years working, and your unit. And also, this is important. What is one word that describes your resilience? I myself, I'm a nurse for 24 years, mostly in maternity and correctional unit, as well as psych. And my resiliency word is perseverance. So let's hear from some of you. I understand some people are at work right now, so it might be hard to talk. So you can just chat in if you'd like to. And we will forward. We wanted to tell you a little bit about the program. We're part of UBHC at Rutgers. This is a reciprocal peer support evolution. What does that mean? Is here at the call center, we take care of unique populations. We rescue the rescuers. These high-risk populations have a shared lived experience. So we're culturally connected. So for example, if you call the Nurse2Nurse line, you will only get another nurse. And then as you can see here on the poster, there's a cop-to-cop line. They speak to each other, moms and the caregivers down there. In case you guys know anyone, the caregiver unit, the caregiver to caregiver, you can also reach them. We are strength-based. We like to focus on your strengths. And then from that, you can deal with any type of challenge, but you first have to know your strength. That's so important. This has been going on since the early 90s. Cop to cop is actually even a national line at this point. If you know any cops in your life, I guarantee you they are familiar. We do focus also on prevention, intervention, and postvention, which means can I talk today? Prevention is something like this, a webinar, getting yourself together with some self-care tips, learning a little bit. Intervention is our ongoing support phone calls, which we absolutely love here at Nurse2Nurse. And postvention is we also offer debriefings. You guys are nurses, so you're probably aware whenever there's a very big traumatic experience that happens to an individual or an institution, we can send in a team to help debrief, for example, all of the nurses that were in that. Advance, please. Nurses are first responders. You are the rescuers. I know we don't like compliments, but you guys are. You're the rescuers. Come on, we are. Advance. Just a tiny little bit about the Nurse2Nurse peer support program. As I said, we're part of UBHC here at Rutgers, and we are grant funded. This, you can see who we're grant funded by right there. But why this is most important is because we are not affiliated with any nursing licensing organization or hospital, health system, any healthcare facility. So it's extremely confidential and extremely anonymous, which I know us nurses with our licensure and such, we really, really need. So this is the perfect place. Advance, please. This is our flyer for nurses by nurses. And we definitely highlighted right at the top there, confidential peer support. Confidential. Advance, please. All right, let's open up this conversation about connection with a favorite quote of mine. Nurses will understand this. It's in your nursing heart. Compassion opens limitless doors to human connection. We know that, we feel that, and we live that. Advance, please. Feels good to hear though, right? We're also very familiar with Maslow's hierarchy of needs. And today we are talking about connection. And look where that belongs. Number 3 on the list. Love and belonging, family, friendship, intimacy, and a sense of connection. Advance, please. So through my research, I found that one challenge for connection for nurses is our long hours. There are 12-hour shifts, many times right in a row, also being on call and having to work overtime, the short-staffed problem that has always been going on, but even more since COVID, exhaustion, physical, mental, emotional, absolute drained that you might not feel like talking to anyone. You might not feel like connecting with anyone. You just might want to decompress on your own. But connection's important. You should, and we'll talk about that. Less time for self-care. You know, all of our schedules are crazy. I understand that, but we're going to teach you about how to get just a little tiny moment in there for yourself to connect. As I said, COVID has impacted all of this. Also, interestingly enough, greater than 62% of the nation's 2.5 million nurses work in hospitals. So most of these things that we just went through applies to 62% or more of our all of our nurses really, but the hospital nurses have the 12-hour shifts, right? And the short staff, that's kind of all around. Okay, advance, please. So how do these long hours hinder connection? There's a lack of equilibrium to work-life balance. I think everyone can agree with that one. We also put the needs of others before our own needs. Lack of time to connect with your support system, less time for self-reflection, less time for individual ways to de-stress, less time to experience nature. See how I keep saying less time in there? There's a reason for that. Advance, please. Again, we're going to go over things that you only need 30 seconds to a minute of your day. COVID impacts to connect. COVID has really impacted our world as nurses. And not a lot of people understand that, but here at Nurse2Nurse, we completely understand it. Heavier workloads. This makes that exhaustion even more extreme. So it makes it even harder to feel like connecting. You're just too tired all around. Our caring nurse hearts. So we have been working more because it's our calling, right? Despite what we're going through, it's our calling, and nurses show up. I think COVID has highlighted that, but it has taken quite a hit on our nurses, all of us. Unique emotional work experiences. You know, our job is unique and what we see is unique, right, guys? And we're unable to talk to our closest supports about this. They might not understand. When you say you had a hard day, you might have experienced 3 or 4 deaths that you saw, and not belittling their job and what they've done, but they might have got really frustrated because their computer wasn't working all day. That's you know, it's really difficult, kind of apples to oranges there to discuss it. Also, do we want to talk about it with someone who doesn't understand the intensity of it? So it might make us turn us off a little to connecting. And the quarantine. You guys, you worked all the way through COVID, and then you had to come home and you had a quarantine. This created an isolation. And even though we've been out and about and the world seems to be, you know, back on its feet, problem is that this isolation that we all went through, especially you nurses, it's kind of hitting everybody in their mental health now. So let's talk about how we can help all this. Advance, please. Oh, before we do that, the UPenn resiliency skill set. So this is a study that was done at the Positive Psychology Center at UPenn. They did this huge, very thorough study on the resiliency skills of human beings. And they came up with 6 that all human beings can have. And I say can have because you have to work on it. And it's not just that you obtain it and then you're good. It's lifelong work that you have to do on it. And when you have one of the 6 out of whack, it affects all the others. You can't have one without the other for this. So today we're talking about connection, which is the ability to build and maintain strong, trusting relationships. Advance, please. So let's start. First, we're going to start talking about connection to self within the workplace or outside of the workplace. Create an extra moment for yourself. What does this mean? What this can mean is that, you know, sometimes creating a moment for yourself can be as easy as when you're driving home from work and you get home, take 2 minutes to sit in your car, maybe listen to your favorite song. Do just sit in silence. That's your time. I also have here journaling, self-reflection. Of course, you can write it all out in a journaling book. That's great. And I do that myself just to get it out of you. That is the whole point of journaling. And I'm going to say something. It doesn't have to be formal. You don't have to journal in a book. It can be as simple as when you're at work, in your scrub pocket, there might be a piece of paper. If you're really frustrated about something, write down the words that you're feeling. So if it's frustration, anger, sadness, write it out and then just tuck it back away. They're all forms of journaling, as well as it says there, self-reflection. Mindfulness activities. This can be something as simple as, sorry, I have a bunch of things in my mind about this, but this can be as simple as, you know, I'm having a mind blank on this one, but you guys probably have some great ideas. So how do you connect with yourself within the workplace or outside of the workplace? And what does that look like to you? Just use the chat. And by the way, even though this is being recorded, again, we're all about anonymity here. So the chat will not be in the recording. Excellent. Mary says she talks to herself positively with positive affirmations. And yes, thank you. Thank you, Mary, for saying that. That's a great thing. And that was actually one of the mindful activities that slipped my mind right now because I wasn't being mindful. And that's exactly correct. So a way to connect to yourself. One of the best things is when you're feeling as though I'm not in the moment. I might be feeling a little out of control in that my sadness is taking over, or grief is taking over, or just frustration is taking over. That is a great time to stop, pause for a moment, and just sit in silence. Clear your mind, and most importantly, take 3 to 5 really deep breaths in and out, in through the nose and out through the mouth. Then you can come back. That's a mindful activity, and it probably takes less than 15 seconds. So these are things that you can do in your day. Anybody else? All right, we'll move on. Here's a great video. I really wanted to take this time for a little self-care for you guys. So just sit back, take a listen, and see what you think.
Today, we're going to be talking about showing up for yourself. So when there's a lot going on in our lives, in the world, when it feels as though there's just no more space in our mind, it's really tempting to let go of the things that are most important to us and the things that are going to keep us healthy and well. And now more than ever, it's really important that we focus on those things that are going to keep us healthy and well. So as much as possible, if you can, find a time to meditate, find a time to step out of the thinking mind, to rest the thinking mind and just be present. Make sure you're taking time to exercise if you can. Most of the gyms are closed down. It might mean going out for a walk, it might mean going out for a run, it might be doing something at home. But whatever it is, make sure that your body is getting some kind of physical movement. Make sure you're getting enough sleep. Sleep is so important. It's important to our immune system. It's important to our cognition. If you don't get enough rest, then you're going to compromise all kinds of different aspects of your health. Eating, right now, eating's going to be difficult for all of us, and we may not get everything that we want. But continuing to eat as healthily as you can is going to be a really important part of staying healthy and well. And then finally, finding a sense of play in your life. In the middle of a global pandemic where so many people are suffering, and maybe people really, really close to you are suffering as well, play and a sense of joy can feel so far removed and perhaps even unnecessary in our life. But if we can find even a couple of moments in the day where we smile, maybe even laugh, find something that brings us a sense of joy, that has a very real impact, not just on our mind, but also on our body. So just making sure that you're looking after yourself. Remember, it's not selfish. It's not just for you. It also benefits the people around you as well.
All right. And when you hear that, my nurses, it benefits the people around you as well. That might tug at your heart, being that us nurses, we care so much, and we want to make sure we're there for everybody. But you have to fill your own cup first. So these things are very, very important. By the way, showing up for yourself can be as easy as grabbing a cup of coffee and stepping outside your unit or into a private area and taking 2 minutes to enjoy the taste. Get your senses involved in it. Enjoy the taste, the warmth, feel it in your hands. And just think, what happiness is this bringing me right now? And I'm grateful for this moment. I guarantee you that moment, that'll take you a long way for the rest of your day. Okay, if we can advance. Connection to nature, grounding yourself in the moment. I know your eye goes directly to the earthing, and we'll talk about that in a second. But first, let me just read these bullet points here. Add nature into your daily routine. How to do this? Start with a small daily activity and then build upon it. So a lot of people, they say to themselves, I'm going to add nature into my day. I'm going for a walk outside. I'm going to go for a hike. And this is all planning, planning, planning. But how about if I said to you, step outside for 2 minutes and breathe in the fresh air. Feel the warm sun on your skin. Take a look around at how green and beautiful everything is, all the life that's around you. That is exactly what I'm talking about here, starting small. And like I said there, involve all of you, all the 5 senses, guys. Another thing you can do, if you are stuck in the office or in the hospital, watch a nature video. They pop up all over the place. And they're whatever your preference is. Some people like the woods, some people like the ocean. Watch it. 30 seconds, 2 minutes. It will impact you. Or if you don't even have time for that, this is one of my favorite things to do, is just to look out the window. I look out this one window in the office in my home, and it has these beautiful green trees. And I can't tell you how many times I do that, and it helps so much. Also, we will talk about this earthing right here. I don't know if you guys have ever heard of this. I know it sounds a little on the hippie side, but bear with me. Look, there's scientific evidence. I brought that for you, my nurses. When you walk around barefoot in the earth, free electrons are transferred from the earth into your body. And this grounding effect is one of the most potent antioxidants we know of. When you get home, throw your shoes off from the car and walk across your lawn or the strip of grass in front of your apartment and just connect with nature for a moment. That's all. It doesn't have to be a long walk, just something fast. Also, chat in right now. I'd love to hear some more ideas. How would you like to connect with nature? And also, Bethany, I saw that you said that you walk the dog for your self-time, and I love that. We can't forget about our furry friends. They are a huge connection for us. So in what way would you like to connect with nature? Let's hear from you in the chat. Yes. Connecting with nature and God. A lot of times they do come hand in hand. Teresa, the smell of the beach and the warmth of the sun. Isn't that so unbelievably refreshing? It's recharging. Mary says she looks out her sliding door at the yard. She has trees and bird feeders. She can see the birds eating and hear them singing. See, that involves all those senses, and it really makes an impact to us human beings. I mean, we're alive too, just like them. Sometimes you just have to kind of look out the window or just put yourself in nature to really realize how connected we are. It's a beautiful thing. And so what I would like to do is we're going to play about 2 minutes of this. These are going to be nature scenes. Oh, gardening from Mary in the chat. Yes, absolutely. Get your hands in there. Smell what's cooking inside your gardening, your garden. So right now we're going to connect with nature in this exact moment. So I hope you enjoy it. Ravi, go ahead. 2 minutes. muted myself. That was awesome. So we have other people talking about how they connect to nature. Someone says, sounds silly shopping at the local fresh garden market for fruits and vegetables. Nothing silly about that. Barbara, that is wonderful, right? To be able to actually feel the fruit in your hand, smell it, and know that came from nature. It's a beautiful thing. Yes, then eat it. Absolutely. Yeah, music and sunsets. What a wonderful thing. How does everyone feel after that video? I can tell you how I feel. That in the background was Pachelbel's Canon, which is my favorite relaxing song, along with the nature videos. That's why I chose it. That really relaxes me, makes my heart calm. Relaxing, Mary says. Yes, Teresa says she loved it. I agree with you, Teresa. Okay, next up, we have connection to others, which is what we're doing right now. So let me just for a second praise you guys for coming on today to connect with others, other nurses especially, right? So think of your own circle of care. Who supports you and makes you feel most comforted? And here's one of the self-care activities that you can try and do. Write that list just on a tiny piece of paper or a Post-it, the top 3 people that you would choose, okay? Now I want you to take that and put it next to your computer, or if you're in the hospital, in your scrub pocket. And when you, during the day, you'll look over, and just as a reminder, will bring you so much comfort in itself to know that those people you have an intense, beautiful connection with. And also, we can talk about peer support, which is what Nurse2Nurse is. The intensity to our work environment sometimes hinders us from support from our circle of care. Again, going back to what I was saying, they might not understand. So a place like Nurse2Nurse, for example, fellow nurses, we definitely know, and we're here to listen. So, and we're here to develop a wellness plan too. We're not just listening, we're talking it out with you. We're hashing it out with you. You know, it's a really beautiful thing. By the way, with your coworkers, you can also get peer support. I'm sure you have a couple people in mind already, but here's a self-care activity for that. It's going to sound simple, but I'm telling you, it works. Walk by somebody, say, hello, with a smile. Boom. Connection was just made. See how simple that was? I know it sounds so simple, right? Too simple to actually work, but it works. If you want to extend on that, hey, hello, how are you doing today? And stop for a real quick chat. Maybe they say, oh, you know how these days are. Oh my God, it's so crazy. That was connection you just made. And those little things throughout your day will take you a really long way. Yeah, so chat in. What is one way you would like to connect with others? Barbara says, my newer neighbor is an emergency department nurse and we help each other. See, that's exactly it. You have that cultural connection. You understand where each other are coming from. Love that. Anyone else? What's some ways you would like to connect with others? Well, I'm about to give you a task. Oh, holistic nurse rounding. Yeah, going around, rounding, see what's going on with everybody, checking in on them. I love that. A lot of connection there, a lot. Different nursing organizations, absolutely. When you get involved, you talk to each other, you realize that what you're feeling is normal. It normalizes these feelings that we're having, these overwhelmed feelings, maybe again, grief that stuck around a little too long, traumatic experiences. Texting funny memes to keep humor in difficult situations, 100%. Nurses are so known for this. We have a little bit of what they call a dark humor, but we love it, right? It's fantastic. Offer gratitude. Exactly. You can connect with others just by saying how grateful you are to them for the most simplistic things. Like, for example, today, Ravi is helping me with this webinar, advancing the slides and doing so much more in the background. I really appreciate him for that. And that connection, I thanked him right before this, really helped make my smile a little bigger today, made me feel a little better on the inside. I love all these chats that you guys are putting in here. And let me read this slide before we continue on. Human connections are deeply nurtured in the field of shared story. I tell you my story, you relate, and then you give me your story. And if I can go right back to what I was saying about stopping someone in the hall and say, hey, how's your day going? And they, oh, it's a bear. And you go, oh my God, yes, it is. You just told each other a story. That's exactly what that is. You had a human connection. Mary says being helpful to one another. Yeah, exactly. And isn't that what connection is? We help each other's hearts out along the way. So I love that. Thank you, guys. Advance, please. Oh, I've got a good slide for you guys next. I've been waiting for this one. Interaction. Let's do it. Let's connect with others right now. Let us all together take 30 seconds to text a loved one the following. I hope you're having a good day. That's it. I'm doing this with you. 30 seconds. Ravi, you got the timer there? Thanks, buddy. We're doing this. You're all doing this.
All right, we're going to start right now.
All right. I hope you're having a good day. That's all. That's all you're saying.
Okay, let's wrap it up.
You know what's funny is that I was smiling when I was writing that and sending it. I don't know about anybody else, but right away, it worked right away. What was the message? Very simple. I hope you're having a good day, which is true, right? That's authentic. You really are. They're your loved one. They're your support system. They're your circle of care. Of course you want them to have a good day. You just connected via a quick text. These things are very simple to do during the day, and it'll put a big old smile on your face, make you feel warm in here. All right, advance. So why is connecting important? Connecting with yourself allows you to process your emotions safely and cope with stress. Connecting with others allows us to tend to our social wellness. And connecting with nature allows us to ground ourselves in the present moment. It's one of my, that's why there are so many things you can connect to. I could have easily chosen art or music or so many other things right there, but nature, it grounds us. That's the beautiful thing about it, because it's happening right now, live with us, and it's part of us. We're all alive together. Also, connecting with yourself. I wanted to bring up something because I know I had a little moment there what I couldn't remember. Another self-care activity you can do for that is pretty simple. Have I forgotten it again? Wow. Oh, okay. So earlier I said you can sit in your car for 2 minutes. what I wanted to add to that is you can just go sit anywhere for 2 minutes in silence and just self-reflect what's going on. The best thing you could do is give a label to what you're feeling inside. So if you're sitting there and saying, I'm frustrated. And it's better actually if you say it out loud. You labeled it, it's out of you. And now you can continue with your day. I'm telling you, these things can go a long way, guys. And connecting with others, I mean, how can I not bring up the beautiful connections we have with our patients, right? That's something that our nursing hearts, we live for that. I mean, the moments that we experience, the vulnerable moments with these people is a blessing, right? And that's another thing, is that when we try and connect with others about these experiences, if you haven't been there, like us nurses, we all know what it means to be in somebody's most vulnerable moment. If somebody else has not been there, it's difficult to have that conversation with them, but that doesn't mean that you can't still connect to others. There were a lot of suggestions in the chat, different nursing organizations, this, that, and of course I'll bring up Nurse2Nurse because we're only nurses here. We get it. And I'll say again, I'm going to put our furry friends in there with all three of them: yourself, others, and nature. Why they're yourself is because they're in your heart. Why they're others is because they're alive and they're furry friends and they're kind of human to a lot of people. And why nature? Because hey, all the dogs, cats, they're all an incredible invention of nature. Such a wonderful thing, companion for us humans. Advance, please. Yes. So I just wanted to, real quick, before we get into other things, give you the Nurse2Nurse Follow Up. If you are interested in having this cultural connection with us nurses here at Nurse2Nurse, our experience is that the national call center is that individuals during crisis do not reach out for help. Guess what? For nurses, it's even higher. You know why? Because we have a hesitancy to reach out because we're usually the ones helping. And I'm not saying everybody, but I know for myself personally, I might not reach out for help because I don't want to be a burden, or a feeling of I should be strong enough to handle this, or I'm the only one feeling this way. So, you know, why should I do it? Or, hey, I don't have time for that. I don't have, you can make time for yourself. It's very, very important that you do. Remember, without your cup full, you can't help other people. And that's what we want to do. We want to keep helping other people, but you first have to make sure that your well-being is taken care of. I can't stress that enough. During COVID, we provided significant support by making outreach calls with peer counselors, connecting to explore your needs. So there's a lot of research behind us as well. I have to say that we are an evidence-based practice. For nurses, that should perk up your ears when you hear evidence-based. We are an evidence-based practice, which is really cool. We do need permission and a good phone number to connect after this event to provide, again, confidential. So important to us. So important to everybody, but nurses, we also have the hesitancy because of our licensure. But I'm telling you, it doesn't go past our ears here at Nurse2Nurse. No one else is listening to their calls except for that other nurse on the line. And it's individual peer support, just individualized to you and what's going on with you. And we focus on, again, we focus on those strengths So if you are interested, which I hope you are, there's the confidential form in the chat so we can keep connected to you moving forward. And there is a box on there. By the way, this isn't just for the peer support of phone calls. This form also just, if you just want to give your email, it's just for us to remind you of more of our resources that are coming up. For example, when the next webinar is, etc. So in the box, you can put ongoing care, a call, yes or no. So you're not locked in to us calling you, but I would highly suggest it at least for one phone call. Yeah, I think you'd be surprised at the connection that you'll make. I'm just going to read something from the chat here, if I may. Nurse colleagues had an emergent surgical procedure let down by not having good nursing care in addition to poor outcomes. Yeah, that really lets, and then Mary wrote, that really lets me down as a nurse. I'm sorry that happened to her. And exactly, nurses are so stretched thin right now in every single dimension in their life that I mean, it's hard on us. It's very hard. And we definitely need to take care of ourselves. And human connection. Did everyone notice what happened during COVID when they took the hugging away and physical touch? That really affected all human beings. So that should prove without even a study how important connection to other human beings are. Ravi, if you can advance. Here at Nurse2Nurse, we have a live peer support helpline. We also, with those calls, it can be a one and done thing. You're just calling, want to blow off some steam, boom, done. Or it can be an ongoing. And the difference between us and, let's say, a therapist, because we are not therapists, we're just your peers, is that instead of you having to make an appointment with us, we schedule a call and we call you. I can't tell you how many times I've called a client and they are just thrilled that they have somebody to talk to at that exact moment. They might have forgotten about the appointment, and they'll say, oh, thank God you called. This is just on my mind. This just happened at work, blah, 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 blah. Can't talk anymore. Talk to you later. Then there's also the ones that say, I've been waiting for your call all week because I knew you'd be the only one to understand this. So it's a really cool thing. We also have online chats, these webinar series. There's a lot on social media, so you might want to check that out. We also have outreach events. And we also have a new Nurse2Nurse provider network, which are doctors, therapists, whether they're just a primary physician or a psychiatrist that specifically treats nurses. So they know our culture. And I'm just going to look a little here in the chat and say that somebody says Nurse2Nurse is an awesome resource. Thank you. I reached out to Nurse2Nurse and found solace and support. Thank you. Love to see smiles. Love that. Another one said, me too, just reached out to her this morning and sent her something to make her smile. FYI, learned from a Vietnam Army nurse, suicide line will go to 988 July 16th, your birthday, happy early birthday, rather than the long phone number. And that's fantastic, right? Mental health is so important right now in our nation. I'm so happy that this 988 number is going out July 16th. I can't tell you how thrilled we are here at the call center. It's It's made a lot of us very happy because we understand how quick, just like someone's having a heart attack, if someone is in need of mental health services, should be the same, just that fast. It's that important. It's somebody's life. All right, forward, please. Yes, this is our webinar flyer, and I would like to apologize that the registration link is not working. If you have the flyer from prior, we changed it. But I do want to let you know that our next one is June 30th. It's going to be on, get your smiles ready, optimism, reframing your way forward. And just a little bit on optimism. A lot of people think it means you're happy all the time. That is not what optimism is. Optimism is knowing that it's going to turn out okay. That big difference. You can see someone that never smiles, never looks happy, but they can be the most optimistic person you know, because they have that inside them. That's a resiliency skill, that they really believe that everything will work out. I actually am very optimistic myself. I always have been. All right, advance, please. All right, we always love to do this on the webinar. I tell a nursing heart story, and I see if anyone wants to share one either in the chat or verbally. What is a nursing heart story? It is defined as a moment when you witnessed a nurse caring for another in a way that touched your heart, that connection. My story is simple, but it was so impactful. I was running around and I had a very tough delivery, a labor and delivery nurse. And again, you know, there no debriefing or anything, just kind of get on with your day. But a coworker, not even, I wouldn't even say a friend, just a good acquaintance, I guess you can say. She always had the biggest nursing heart. That's why I chose this story. She just saw me walking down the hallway, and she did it pretty cleverly, is that nobody else was in the hallway at the time. She said, come in here for a second, going into the coffee room. And I was like, okay, maybe there's new coffee. I don't know. So I went in there, and she grabbed both my hands, and she's like, just tell me everything right now, and then you'll go out there and you'll feel a lot better. And I did not want to talk to her at that moment, but she said, come on. And that connection of the physical touch, the eye contact, hearing her soft voice, the fact that we were in an enclosed space, and that I trusted her. And I didn't even know I trusted her until that moment, because we were connecting. And I did, just real quick, I said, da 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 da, here's how I'm feeling, and da 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 da. She's like, okay, no opinion, no judgment. She goes, okay, let's get back to work. And that was it. It's one of my favorite moments of connecting. I mean, I have a million of stories about connecting with patients, but there's something about someone just grabbing you that you didn't expect and connecting that makes you feel that human connection. It reminds you of that human connection. Does anyone else want to share a nursing heart story of theirs? You can, it can either be you witnessed another nurse, or maybe something that happened to you, or maybe a moment you connected. That's all right. Sometimes we want to keep those sacred moments to ourselves, and I completely understand that. Again, here is everything, all of our resources. I hope that anyone that wants to call us does. We are here for all of our nurses because we are nurses as well. We share that same caring nursing heart. Forward, please. And let's see, again, another slide to show you all the different ways that you can reach out to Nurse2Nurse. Our phone number, by the way, our hours are Monday through Friday, 8 a.m. to 8 p.m. We have a Nurse2Nurse website. There's some great information, some inspiring stories, and it's getting a makeover in June. So that's going to be pretty cool. You can request an online chat. We've had a lot of chatters recently coming in. That's, you know, for them, that's full anonymity. And I can tell you that the cultural connection, or just the connection, has been so strong that they have ended up calling. So to me, that's a successful connection, right? That's as human as you can get right there, that you're just chatting away on a computer and you finally feel comfortable and say, hey, yeah, let's chat on the phone now, you know? All right. If anyone we have, let's see, ooh, I bought everyone 5 minutes. So if everyone is ready, I'm going to say today, my challenge to you is to connect in one of the 3 ways that was on the webinar today. I'm hoping everyone did the cell phone thing and texted somebody, but you can still do it anytime during the day. And just, hey, it only takes a second, and just see how you feel afterwards. Same thing with nature, and same thing with taking a moment for yourself. All right, guys, that's today's webinar on connection, peer support, and your circle of care. I hope to see you all next month, and you've just been absolutely fabulous this whole time with chatting in, and we here at Nurse2Nurse are here for you. So give us a call, chat in, whatever you need to do. We're here for you, and we understand. All right, thanks, guys. Have a beautiful day.